Well, the most common option is when it's depending on where it's at is to do something like a shockwave lithotripsy. That's a machine where you sit in lay on a table with a bag of water and shock waves go through the water. Your body's mostly water, goes through that, and it's aimed at the stone and causes it to break into powder. The powder is much easier to pass than a big stone. But that doesn't always work. Sometimes it gets stuck in the ureter, as we see in that middle one. And then we use something called ureteroscopy. So that's a scope that we can place all the way up in a skinny scope that goes all the way up into the ureter, and we can get right up to the stone. Sometimes we can grab it and pull it out. Sometimes we blast it with a laser beam to make it small enough to get it out. But we'll get it out. For very large or complex stones, we sometimes have to resort to going from the kidney side. And then it's something called a percutaneous nephrolithotomy, PCNL for short, which is a small incision, placing a scope through the kidney itself and going in that way and grabbing stones.